Patients pursue gender affirmation surgery for a variety of reasons, and there are as many different reasons for surgery as there are different types of people. Right? Not every transgender or non-binary person wants surgery. My name is Jess Ting, and I'm Director of Surgery at the Mount Sinai Center for Transgender Medicine and Surgery. And as part of my surgical practice, I perform gender affirmation surgery for patients who are transitioning male to female or female to male. Every pathway to transitioning is different, but I only see patients, that small subset of transgender and non-binary patients who actually are seeking surgery. For those patients, there are a variety of reasons, and most of the things that I hear on a day in and day out basis are along the lines of, I want this surgery because it's gonna align my body with more of what I feel like would be my authentic self internally.
Before I was able to come out and transition, I was really angry and scared of what people would think about me. I was just so uncomfortable, and I remember I would look at myself in the mirror and be like, is it okay that I feel like this? Am I alone? Just really confused and coming to terms with my place in the world and how I can be happy. Before I had my surgery, I had a lot of gender dysphoria, and that pretty much means like discomfort in your own body. And for me, I had that specifically when I would see my genitals or have to deal with anything down there. So after my surgery, all of that pretty much went away for me because I felt so happy and I could look at myself in the mirror and be content with what I saw.
Our role is to ensure that patients are in the best shape that they can be in for surgery, both physically and emotionally, psychologically, and also, very importantly, in terms of social support. And all of our patients are seen by a primary care physician, by a mental health professional, which means a psychologist or psychiatrist, and also seen by a social worker.
The day before my surgery, I wasn't even nervous. I was just so excited and focused and happy that this moment in my life was about to happen.
This is a huge surgery, and we want to make sure that patients understand what they're getting into, that they know what they're signing up for, and that they're prepared for the recovery and all of the potential complications and outcomes from surgery.
I had a lot of time to prepare mentally for the surgery, so by the time it finally came, I was ready for it. I had my gender confirmation surgery at the end of the school year, so I had the summer to recover before going back to school in the fall for my senior year of high school. I was 17 years old, and it was 2 months before my 18th birthday. It has been a year and a half since I had my gender reassignment surgery, and I'm as happy as I can be. Finally, I feel like how I feel on the inside matches on the outside. You know, I have a vagina, everything is just so great for me, and I don't have to worry about tucking or anything like that. I can wear the clothes that I want and be comfortable in my body.
So when Tressa first came to me for a consultation before surgery, I think she was 16 or 17, but she had transitioned many years earlier, so she knew exactly what she wanted. I was just struck by how composed and mature she was, and she just had this incredibly positive attitude, like this exuberant and positive aura about her. It was just very infectious. And I was also struck by her mom and what a wonderful, loving relationship they had and how supportive her mother was, which I just love to see because it means everything in terms of happiness and outcomes for our patients when their family supports them in their transition.
Personally, for me, my whole life I've known that I wanted to have surgery. When I had my surgery, it felt like my whole life had led up to that moment. But not every trans person wants to have surgery, and every trans person's journey is different, and every trans person is different. And there's no right way to have a transition. It's about what makes people comfortable in their own body, and specifically for me, having the surgery was necessary. But for a lot of people, it isn't necessary. And there were moments after the surgery when I was still healing and when I was in a lot of pain where I was like, was this worth it? Like, did I want to go through this? And obviously that was just the heat of the moment because I was going through a lot of new things that I had never felt or experienced. But I know to this day, it was so worth it, even if there were those moments where I questioned it.
You know, I always just ask my patients, how did this change your life? And how did this improve the quality of your life? The answers that I hear are things like, well, Dr. Ting, I have just always felt like this aspect of my body doesn't fit who I am. It's not my authentic self. And having the surgery enables me to feel more comfortable in my body and allows me to feel like my external appearance, my physical body, is the best representation of my authentic self.